Hello, my name is Matthew Vickers. I'm a psychiatric mental health nurse practitioner student at Eastern Kentucky University. Today's video presentation is intended to accompany the PowerPoint presentation found on the NSC 890 discussion board. People with schizophrenia have difficulty adhering to outpatient treatment. Poor adherence often leads to relapse, readmission, and increased cost to individuals, families, and healthcare institutions. Failure to adhere to a treatment plan disrupts the patient's progression to a state of better overall mental health and normal functioning in society. It is important for mental health clinicians to understand causes of non-adherence and discover methods to improve adherence. Pender's health promotion model was used to guide the development of a PICO question related to the problem of adherence. The question is, in adults receiving treatment for schizophrenia, how does frequent communication with care providers, in addition to treatment as usual, compare to just treatment as usual to affect outpatient treatment adherence within 6 months of discharge from a mental health facility? This PICO question provided the jump-off point to begin a review of literature. The search for applicable literature started by plugging in various keywords from the PICO question into search boxes in several databases. Search results were limited to publication dates between 2010 and 2016, and only randomized controlled trials were included. Studies were also limited to those that included components of the PICO question. That is, patients with schizophrenia as the primary population, a measure of adherence based on intervention, and communication as the primary intervention. 3 studies were identified for this literature review. Beebe, Smith, and Phillips conducted a randomized controlled trial to examine the relationship between communication and adherence. Participants received phone, text, or both phone and text prompts for psychotic problem solving. Monthly pill counts were done to measure adherence, and subjective symptoms were measured using a questionnaire. The study found that participants receiving both text and phone communication showed lower symptom scores, but only slightly higher overall adherence. The researchers speculate that the lack of a true control group may be the reason for the insignificant difference in adherence scores. Pinnenborg et al. Conducted a randomized controlled trial comparing the effect of text prompts on daily goal attainment. The intervention group received daily reminders about goals, and the control group received treatment as usual. Pinnenborg et al. Found that participants receiving the text prompts had significantly higher daily goal attainment than participants who received just treatment as usual. In Study 3, Wallenstein et al. Conducted a randomized controlled trial to measure the effect of pharmacy-based intervention on medication adherence over time. The intervention provided various reminders to help patients adhere to prescription therapy. The study found that pharmacy-based intervention produced a significantly higher level of medication adherence than standard treatment alone. Looking at the relationship between communication and treatment adherence, all 3 studies demonstrate that increased communication results in increased treatment adherence. Applying this evidence to practice, it can be assumed that increased communication between care providers and patients would result in higher levels of treatment adherence than standard treatment alone. Based on the evidence, a proposed intervention would be set up in a nursing communication hub at an outpatient mental health clinic. Have nurses who are trained to use communication tools send daily phone and text prompts and questionnaires to patients being treated for psychosis. Advanced practice nurses would then provide follow-up communication when prompted by the standard communication tools, and prescribe further treatment as needed. As a result of this intervention, patients would be expected to have better overall treatment adherence, and subsequently have better mental health outcomes. This concludes the Integrative Review presentation. Thank you for your time.